Hello everybody, Andrea Majewski here with Dentalelle. I actually just saw a patient. You can still see my loop marks on my nose. I have very sensitive skin, so everything leaves marks, even if, glasses on for 2 seconds leaves a mark. Anyway, so I'm here to talk about silver diamine fluoride and how I actually use that in my dental hygiene practice. I use this stuff literally almost on every single patient. That's how often I use it. So it is called Advantage Arrest by Oral Science. Amazing company. They have everything. I love them. And I use it in combination with another thing from Oral Science as well, a fluoride varnish. Florimax, however you want to pronounce it, Florimax and Advantage Arrest. So how do I use them? So for silver diamine fluoride, that is for if I suspect a client has a cavity. Large, small, if I suspect they have a cavity, I tell them they need to go see a dentist for a dental exam and x-ray to confirm, but I do suspect they have a cavity. How do I know? If I'm looking in there and it looks like a cavity where it's a brown area, black area in some cases, and if I take my instrument and it's sticky, it's like pitted a little bit, that's a pretty good indication. If I put this on, silver diamine fluoride, Advantage Arrest, I use a little tiny micro brush. So I'm going to show you guys two different types of brushes. There's a micro brush and they're both micro brushes, but you see how the purple one's a lot tinier? Here guys, I'll kind of show it to you this way. See how the purple one's a lot tinier? This is for silver diamine fluoride because this stuff tastes horrible. It's technique sensitive. You have to be careful with it. And it stains. So if you're not careful with it, if you're just sort of brushing it on, wherever, it will stain black. If you get it on your lip, cheek, inside the mouth, tongue or something, it will stain black. The stain goes away eventually, but I mean, who wants to walk out of a dental hygiene office with a black lip or something, right? So you want something more precise, like the purple micro brush. Okay, so I put it in a dampened dish. One drop is all you need for probably 3 different teeth. It depends on the size of the areas, but 1 drop is all you need, you guys. It goes a long way. I charge about $25 per drop. So if a drop gets me 3 teeth, great. The patient only pays $25. If a drop gets me 1 tooth, because it's such a large area, it's $25 per drop because this stuff is amazing. It kills the cavity on contact. It makes the cavity hard again. So it will actually arrest that cavity so it doesn't get bigger. Perfect for a dental hygiene practice where I tell them, I want you to go to a dentist to have these cavities looked at, but they might not be able to go tomorrow or next week or next month. I don't want that cavity to get bigger while they're waiting to go get it looked at because some patients won't ever go. We know that. So at least I'm doing something to stop that cavity from getting bigger. So I use it every day in my practice. I use a dampened dish, the silver diamine fluoride, and the tiny micro brush. But after the silver diamine fluoride, I apply the fluoride varnish for 2 reasons. The first reason is because it just tastes so much better. This stuff tastes like death, okay? Don't surprise the patient and don't tell them that it doesn't taste horrible. I let all of them know, kids, adults, it doesn't matter. I tell them, it tastes kind of yucky, just so you know. But the varnish, so this actually comes in bubblegum, mint, or caramel. I have the caramel. I think it actually tastes pretty good. So I put that on afterwards with a larger brush, because if I try to put it on with this thing, it just kind of absorbs too much because this is like a thicker consistency. So this won't go far. You need the larger brush, this one. So I use the fluoride. I put a drop, all you need, into a dampened dish, and I will put it over those areas that I had used the silver diamine fluoride. But I also like to put it everywhere. So if you are applying it as a general fluoride varnish, you want to put it on the bottom first. So this technique is different from the ones you're probably used to using where you put it on all the teeth everywhere. This stuff is amazing because it's not sticky. Here, let's just do a close-up. It's not sticky, but you put it on differently. Check out the YouTube videos that they have. What you do is you put a thin layer on the bottom on the buccal, the bottom on the top. That's it. Not on the teeth, but just sort of down here. Yeah, down there. I know, weird. The bottom, the top. Have the patient suck in like this and then suck out like that. That's it. They can eat, drink right away afterwards, no problem. I don't use suction for the saliva because I don't want it to clog up my suction. So I do have them spit into the sink afterwards. They can have water if they want to, but I tell them like wait a couple minutes to have it really take effect. But on the back, it does say you can eat or drink right away, no problem. It will not make the teeth feel sticky. So I use this as a general varnish anyway, but especially definitely after this. Do I charge extra for this? It kind of depends. If I'm just putting it on the silver diamond fluoride for whatever reason, no, I'm not going to charge $25 more for that, although I could. But if I'm using it as a general varnish, I do charge $25 for this. This stuff is amazing. You want it. I put this on my own teeth every like 3 months or so just to help to protect things. So I use these, you guys, literally probably on almost every patient. It's amazing stuff. Helps to keep the teeth healthy. It's just great stuff. Helps against cold sensitivity. But of course, the silver diamine fluoride will stop those cavities. I feel every dental office should have it, especially for those areas where they might say, we're going to keep an eye on that. We're going to watch it. Don't watch a cavity. It's going to get bigger, right? Cavities don't get smaller. They get bigger. Put this on to prevent it from getting worse. I forgot to mention, I am so sorry. This will stain the teeth dark, like black. I think I did mention it, but I didn't really talk about it. Let the patient know it will stain the teeth black. The area black, not the teeth. I say this because let's say a little 4-year-old has a cavity here. You want to fix them, obviously. You might want to apply silver diamine fluoride, but if it turns the area black, the parents may not be happy with you. They will likely say to you, okay, we're going to go to the dentist like tomorrow because we don't want that stuff to turn it black. Let them know. Do I see kids where I do put this on these areas? Yes, because I see kids where the parents admit to me that they're not going to go to the dentist anyway because they simply can't afford it. So they would prefer to spend $25 on this opposed to $100 each for each tooth for a filling. They're okay to have it look black. So let people know, parents, kids, whoever, that it does stain the areas black, okay? Even doing a quick Google search, silver diamine fluoride before and after, you will see the difference. Thank you guys for listening. I hope you guys liked the video, and I'll see you in the next one.